It's been an informative afternoon, I know, for all of us. Talking with some people earlier today, the line that comes to mind was, I never thought I would know this much about testicles or say that word so often in my life. But it's an important topic, and I think we've all learned a lot today. Now we kind of have a little shift in the way things are going to work through this afternoon, because with me here on our little stage, we have a number of people who can tell their individual stories with their experience here in testicular cancer. And I know this is going to be a helpful forum for people here today and people watching at home. So we'll start with some introductions quickly. My name is Andy Beckler. I'm just going to be directing flow up here, but I'm not really the one you want to hear talk. So to my immediate left, we have Scott Miller. Scott has been doing some work in television and broadcasting with CTV. He's coming from the Wingham area, and we're going to go one by one here, but we will start with Scott. So Scott, maybe just tell everybody here about a little bit about yourself, and then your diagnosis and where you're at.
Sure. Well, yeah, I'll start with, I do work for CTV Wingham, or CTV London, based in Wingham, and I actually just wrapped up a 3-part series about testicular cancer. I took the camera into my doctor's office, and some of the people that were in that series are actually here today, so I want to say thank you to them again for sharing their story with me and allowing me to get the word out to people. I think it was probably therapeutic in many ways to put together that series, and I think hopefully educational. Had a lot of people, a lot of good feedback about that, so I was pretty proud of that. So my story is, I was diagnosed, or I found a lump 6 days before my family was supposed to go to Disney World. Found a lump in my right testicle, and hard to enjoy Mickey Mouse when you don't know what's going on down there. So we went to the doctor, and on May 2nd, so yeah, April 26th, I found the lump, and on May 1st got into the doctor, May 2nd was diagnosed with testicular cancer. So caught it very early, which was very lucky. Had a surgery on June 3rd, the removal of my right testicle on June 3rd, and from that point forward, just had 7-8 weeks of recovery. Did not have to go through chemo or radiation, and I'm now in a monitoring program at the London Regional Cancer Program. And yeah, that's essentially my story.
Cool. We're going to hear from you a bit later as things become a little more free-flowing, but we'll keep going down the line here. Next up, we've got Luke McKeelson. Luke's from Kitchener. He's been abroad, though, so he's got some interesting stories there. So we'll, Luke, if you want to tell people a bit about yourself and your diagnosis and where you're at.
Okay, thanks for having me. I'm a musician. I'm a guitar teacher, a certified Ontario teacher, and I'm also making my 4th album right now in Toronto, so it's pretty exciting and fun times. Trying to get my music career, keep it running, while also working day jobs and other jobs. So life is fun and busy and good for me right now. Back in 2010, when I was teaching English in Korea, I found a lump on my left testicle, and I went to the international doctor in Korea, and they thought it looked pretty suspect, so I had to get it checked out, ultrasound, MRI. There was a few language barrier problems, but after about a week or two, I met with an oncologist who told me it is 80% cancer, it isn't 80% cancer. And I was really confused. I was like, is it cancer or is it not cancer? And when he said it was most likely cancer, I said, okay, I'm going home. So I sent my MRI results by email to Dr. Jewett at Princess Margaret Hospital, and he said, it looks like that's going to have to come out. I'll take you on as a patient. So I got back to Canada and had the surgery to remove my left testicle. All the scans showed that the cancer hadn't spread. So I was told that the form of cancer it was a 48% chance that it would recur, but that we weren't going to do chemotherapy because it might not be necessary. So I was put on a waiting program where I came in every 2 months to the hospital to get checked out, and I applied to teachers college and everything was going fine. And then I went in for a routine test on the day I was moving to go to teachers college, and I was told that the cancer had spread to my lungs, and I had two or three small tumors in my lungs. And then I went through 3 cycles of BEP chemo, and it really did suck, but you know, there were good days and bad days. There were times where I just felt really depressed, I guess, like I hit rock bottom, but I had lots of family support and friend support, and I moved back in with my parents and they helped me out, and I got through it, and now I'm over 2 years cancer free. So things are looking really good for me right now. The doctors have no worries about it. I still do go through a lot of anxiety about it, and I feel like I have a long way to go in getting my anxiety under control, but other than that, I live a pretty normal, fun life.
I'm sure there's some people either in the room here or at home watching who, if they're struggling with when they got their diagnosis, maybe they can look at you, Luke, and say, well, at least I wasn't in South Korea dealing with a language barrier, wondering when I could get home. It's an incredible story. We'll move on now to the youngest member here of our panel. This is Nick Rees, and he's been working with, of course, Dr. Power. He comes from London area. Nick has just recently gone back to school to finish up high school after about a year off. Is that right, Nick?
Yeah.
So maybe just start by talking a bit about your diagnosis and the treatment that you have gone through.
I don't know. Basically, I was at a show last December, and I was in the mosh pit, and some guy, like some massive dude, like 7 foot tall, grabs me, picks me up, and throws me like 10 feet across the pit. And some guy noticed, and he extended his elbow to block and protect himself. My lower back connected with his elbow. And a couple days later, I woke up with like excruciating pain. It was like 10 out of 10, like the worst pain I've ever felt. So we went to the hospital, and we went to the local clinic first in our neighborhood. And yeah, they gave me some like muscle relaxants, but it just kept getting worse, and I was like puking up the pills like right after I took them and stuff. So we went to the hospital, and they gave me a whole bunch of morphine. So after that finally calmed down, one of the doctors just randomly asked me if I had felt any pain in my testicle recently, and I'm just like, actually, yeah, I have. So so they basically set me up for an ultrasound that day, and yeah, they told me I had a mass on my right testicle and that I was probably gonna have to get it removed. So I was like bawling my eyes out and stuff. It sucked. But yeah, I had the surgery a few weeks later, and then a few weeks after that I started chemo, and yeah, the first week of chemo was probably like the worst I've ever felt in my life. Pretty much, like we didn't have any of the anti-nausea medication like set and ready to go, because like we didn't know what was going to happen. So the first cycle sucked. It was it was the worst out of all of them. And I eventually got through that, and so after the first cycle I had a couple months to recover, and I was feeling pretty good, and then I went back for a checkup, and the tumor markers were up again, so I had to go for another round of chemo. And this time I had to be admitted into the hospital, and that was like my whole summer. And yeah, after that I think a whole bunch of stuff went on, but I think the tumor markers started going up again after that. So they decided to give me a stem cell transplant. So I was admitted in the hospital for like 3 weeks, and yeah, I did that. And then soon after I had my surgery to remove what was left of the tumor. But the chemo didn't shrink the tumor at all. It just like stunted its growth, so I had to get it out right away. But yeah, after that it was just basically recovery from surgery, which sucked a lot too. And yeah, that leads us to now pretty much.
Okay. And Nick, your treatment is as recent as early February, you were saying. Was there,
Yeah.
is that right? That was your most recent cycle?
Oh no, my last cycle of chemo was back in like late November.
Okay.
And then I had the surgery January 10th.
Okay.
So yeah.
Our a couple to my right here, we have Steve and Brittany Shaw. They're coming from the Hamilton area today, and turn things over. Steve, if you want to get things going.
Yeah, my name's Steve. I'm from Hamilton, Ontario, and I was diagnosed August of 2012. I was just going to the washrooms in the morning, and I noticed that my right testicle was a little heavier than my left. And right away, going to my fiancée Brittany, I asked her to take a look, because that's what men do, right? We don't want to know what it is, so we just go right to our wife to go. And she took a look at it, and she noticed it was definitely a little bit bigger than the left, and called the doctor. And right away, I seen him. He couldn't really feel a difference, but just to be on the safe side, he wanted me to do an ultrasound. So I got the ultrasound done. I got the call 2 days after that. Come in right away. We need to do surgery. Chances are it's cancer. So I did the surgery, and the longest part of waiting was to see what type it was. And I did the worst thing while waiting for that type. I looked up online. I researched everything you can think of. Got myself going. I studied every type of cancer that you could have. And I just remember saying to myself, curocarcinoma. I know I'm probably pronouncing it wrong. Curocarcinoma, one of the most aggressive ones. And I was thinking, I don't want it to be that. And sure enough, it was 100% curocarcinoma, one of the most aggressive types. And there were spots on my lungs, and I needed to do 4 cycles of BEP, so 3 months of cancer, or treatment, sorry. And so I definitely, we wanted to do sperm banking, because we don't have any kids right now. And at the time, we talked about it. We just bought a house. It was a month after that I got diagnosed. So we did the sperm banking. It happened so quick, and then because it is aggressive. My tumor markers were about 20,000. After surgery, went down to 10,000, so it was still in my blood, and they wanted to start right away. There was no breaks. So I did that from September to almost end of December. Just it was brutal. First couple cycles were okay, but once you get to the 3rd and 4th, it wasn't easy. She was there for me the whole time, motivating me, trying to get off the couch, trying to get some energy. Just don't sit there, because it's so easy to get depressed, thinking things, researching. Worst thing you can do. It's good to educate yourself, but you don't want to overdo yourself, because that could be it can cause a lot of trouble. After that was done, I think it was about end of December, I did another CT scan to check on the 5 nodules on my lungs, and there was evidence that it was shrinking, so they thought maybe it was scar tissue. Just to keep a close eye, they wanted to do more CT, surveillance every 2 months. And so now it's been almost 16 months cancer-free, so I'm still in surveillance every 2 months. So it's pretty much, yeah.
Great.
Yeah.
The last member up here with us is Dr. Leanne Nolan. She's coming all the way from Vancouver to Toronto to be here with us. She has experience working with cancer patients as an exercise physiologist, and she's going to be a great helping hand for us throughout the course of the afternoon here. So now that we've got everyone's stories, maybe we can just start to talk a little more specifically about some of the things that you guys up here have gone through. We don't have to worry about any overarching themes or major points to hit. We're just going to talk about what exactly you have gone through. And in doing so, hopefully some people here today and at home watching can take some positives away from that. So, Steve, because you just went last, you mentioned it's been how many months now?
16 months.
16 months. But as you were saying to me earlier in the kitchen,
Yep.
There's still
a lot of anxiety.
There's still a lot of anxiety you're dealing with, and some effects of the chemo that you had been through in the past.
Yeah.
If you want to maybe cite that example and talk about that.
So about a month after chemo was done, I had the tingling in the fingers, the feet. It was wintertime, so in the cold it didn't help at all. I have nerve obviously from the nerve damage. The ringing in the ear. Basically, it sounds like you've been to a concert and you hear the distortion in the back of your head there. I still have that a little bit, not as bad as it was after treatment. Yeah, I got heartburn, acid reflux, but I was prescribed some drugs for that to help out. The anxiety and panic attacks, they were pretty bad. I'd say probably the third or fourth cycle, right around there. Basically because I think I caused a lot of it, because I did look up a lot of stuff, and being the type of cancer I did have, you never know what the outlook is, and I was afraid. You know, it was scary, and the anxiety and panic attack, I'm starting to get control over it. Keeping myself busy. I'm back to work. I work for Halton Region in the Oakville area, so I'm busy with that. I have lots of friends and families that come over. They help me out, and Brittany here, she's been here for me. She's definitely keeps me up on my feet and keeps my mind off stuff, even though I go to her a lot. You know, for every little symptom I have, every little thing, you always think it's going to come back, and it's a hard feeling to get rid of. But it's been 16 months now, and it's getting better.
Dr. Nolan, this might be a good time for you to jump in. You know, talk about maybe dealing with a patient who's in a similar timeline as Steve here, and still feeling a bit of effects of chemo. What would you say to someone in that situation?
Exercise is kind of it's a systemic tool, so kind of like chemotherapy, it influences every biological system in your body. It's this beautiful tool. You get the biggest bang for your buck, and that's because it's free. So, but a lot of times it can be scary to start if you're not used to exercise, or you hear stories of people over-exercising or exercising too much, or what should you actually do, and to specifically sort of target that anxiety in that sense. There's multiple ways to think about it, because sometimes we need to understand why you're having that anxiety, but just in general anxiety and depression, we do know that exercise can strongly influence those feelings, and it's a minimum of 30 minutes a day of exercise that induces sweating, and you want to do that at least 5 days a week, and that can help sort of with that a variety of different reasons and why. I don't know if you want to get into that physiology, and if you're going sort of towards moderate to vigorous, so you know you're sweating but then starting to get out of breath, but you can still catch your breath if you stop, you'll have a faster effect, and you'll see that effect within 3 weeks, and you'll see that improvement up to 12 weeks, and then you sort of peter off. So you can feel that effect quite quickly if you choose to go out and do it. When it comes to anxiety, it comes to depression and whatnot. Now, if we know maybe why you're getting that anxiety, is it because of recurrence? Is it because you want to go play soccer with your guy friends and you keep getting out of breath? or if it's because you're nervous because you're going to start dating a new individual and you're scared that you're going to have some sort of, you can't keep it up. So it's sort of, there's ways that exercise can help that, and I'm happy to answer questions. I don't want to babble for too long in this chair. I have a tendency to do that, but I can guide you on those if people are interested.
Well, when you talk about suffering from that anxiety, obviously the thought of recurrence would be one of the major things, but a lot of times it can be things much smaller than that. Nick, I know you mentioned earlier that you still feel a lot of that same anxiety that Steve was saying that he deals with, but could you maybe give some examples of maybe even smaller examples in your life of where now, after going through the treatments, you feel that anxiety?
I don't know, it's not as bad as it was anymore, so it's like not really a noticeable thing for me, but like stuff when like just little things like when I'm driving, like turning at intersections, or like when I'm driving through an intersection and somebody's like waiting to turn, I always like get scared over them, like it's like what if they turn before me or something and I run into them or something like that. It's just stupid little stuff like that, but yeah, I don't know. But other than that, yeah, I got the I had the tingling in the hands and feet, and my foot's still numb. But that doesn't really matter because my hands are fine. So, but other than being extremely sick for weeks on end, that's about it.
Yeah. Nick's hair's starting to come back a little bit. We got a nice little buzz cut going underneath that hat. You wouldn't know it looking at Luke here with the big red hair, but you want to talk about hair coming back after chemo. Here's a guy who's been through it and he's come back. Although you say your hair wasn't always that way.
No, my hair used to be curly, and my friends all in university called me Long Hair Luke, and now that my hair's grown back, they call me Straight Hair Luke. They ask me if I've straightened my hair, and I don't know how to style it anymore because like it was so easy when it was curly, but now I have to go through this straight hair stuff.
I think we had a pretty nice balance up here of some young males at pretty different points in their lives, and Scott here to my left, he's a father. He's got a 6-year-old boy, and that can be a difficult age to have to handle a topic like this. Maybe talk about how you and your wife were able to handle that with your son.
Yeah. I don't know if anyone else has a 5, 6, 7, probably 4-year-old too. They're well in touch with their own anatomy as it is. He's down there already lots, so he knows what's going on. But no, in the weeks, we were really honest with Miles about what was going on. We told him that Daddy's going in for surgery and what could happen, and Daddy can't wrestle for the next 7 weeks. But yeah, it's hard. At one point he asked, does this mean I'm gonna get it? And that's a tough thing. That's still not something I'd like to hear, but obviously I know that it doesn't increase his chances of getting it, so we know that it's okay, but that there's a level, I suspect, of concern on his behalf, and we just tried to be honest with him. That's all you can do. I still consider myself, I almost don't feel probably qualified to be up here with my story, but I still feel, I feel lucky. I just think, I was 34 with a wife and family and friends around and a son. I give credit to everyone, but I think of Nick here, it's the, 15, 16, 13 years old. Are you kidding me? Like, nothing seems fair, but you're 13. Who are you going to go and tell that I've got a lump in my testicle? I could go to my wife, and she's knows what's going on down there anyway. Yeah. But to go to it's really difficult, and that's what I think about. I think about the 13 now, 13, 14, 15, 16, 17, up to, I mean, I wasn't a mature 25-year-old, for God's sakes. I mean, thinking about being that age and finding something, I probably would keep a lot to myself too. And geez, that's why I hope like this symposium is so important, and try and get out to people about, you know, just let go of the macho. You know, it took so long for us to get comfortable saying maybe breast or breast exams 20, 30 years ago. Well, hopefully we'll get to the point where testicle and testicular exams and testicle Tuesdays and touch it Thursdays will be part of our vernacular, and it's not going to be like taboo, because it is still taboo. It's still not taboo, but it's still, we're so embarrassed. And I mean, obviously I'm in it, and I've said testicle more in the past year than I ever thought I would, but you know, it's trying to get across that, get it into health classes. I didn't know anything about this before I got it. Yeah. You know, trying to get the word out there to I think that younger generation that could really, just a little seed in there if they find something to go get something.
Can I interject? I just
Absolutely.
You said that your son asked, you know, Daddy, is it going to happen to me?
Yeah.
And you know, unfortunately, it could, and I pray that it never does. But now he has awareness, and you have awareness, and that's the good thing about it, right? Because now that he's aware, and as he gets older, he's going to be more aware, and he's probably going to check himself more than he would have if this hadn't happened to you.
Yeah.
Right, and that's what's really important is educating younger children and having parents aware that this can happen to your son, and you know, just making sure that they're active in doing those self-examinations even at a younger age. So, you know, it's good that your son is aware, and hopefully it'll be something in the back of his mind as he gets older and always checks himself. So.
Yeah. It's mainly unofficial self-exams right now at that age.
Right. Yeah. Exactly.
That's right.
Yes. Yeah.
Brittany, I'll come back to you in just a second, but you know, Scott, you just mentioned you know, how it's not a time to be macho, and we've heard that throughout the course of the day. Think back to Dr. Potvin mentioning you know, how that's not appropriate. When there's a little thing, go get it checked. And Nick, I know you said that, you know, looking back on it in retrospect, maybe you wouldn't have left the hospital as early as you did. Do you want to talk about that a bit?
Which situation? Like,
Just where I think you said you felt like maybe you went home a week earlier than you should have.
Yeah.
Just to tell people about that experience.
I was like right after my last surgery, and but yeah, like the hospital has been my home for more time than it should over the past year. So I really hate the hospital. Like, I never want to set foot in another hospital again. Like, I'm glad this is a nice hospital, so it's not as bad. But like, yeah. So as soon as I woke up from the surgery and found out I was gonna be okay, I basically just started working towards getting out. So started walking around every day, and yeah, just like trying to eat a little bit more every day and stuff like that. And eventually, after like a week and a couple days, I just said, screw it, I'm getting out of here, because I was sick of it. Like, there's nothing to do and nobody to talk to, and yeah, it's just depressing being with a bunch of older people who are recovering from surgery too. So I got out of there, and for the next like week after that, I was really sick, recovering, and I couldn't eat anything, and all the like hydromorphs and like all the painkillers were just making me really sick. And but yeah, eventually I got some like IV hydration, so like some saline solution, and that usually like made me feel better like through the chemo as well. So the main problem was I was just dehydrated and I was puking so much, and that was just what was making me sick. So. But yeah, I got over it, and like a couple weeks after that, I was fine.
Yeah. So, Brittany, maybe you can talk a little bit about, from a partner's perspective, from a wife's perspective, what was it like for you? The day that Steve first came to you, the day that you guys first heard that C word brought into your lives. Take us through what your thoughts were and how you handled that.
I work for the Canadian Cancer Society, and I work for the peer support program. So every day, my job, I talk to patients, and I talk to caregivers, I talk to survivors. So it's something that I deal with on a daily basis. But the time that Steve told me that he had a lump, honestly, I really never thought anything of it. I just thought, you know, he's a man, maybe there's some changes, whatnot. So when we went in and, you know, he had to have the surgery, I was kind of like, what? Like, really, is this happening? Like, okay, fine, let's just remove it. And he kept telling me from day one, you know, it's cancer, I know it's cancer. And I kept thinking, no, it's not cancer. Like, really? You're 26, like, it's definitely not cancer. And we were just starting our life. Like, there's no way that this is gonna come into our life. Sure enough, that day when we were sitting in the oncologist's office, then the nurse comes in, the student, and says, yeah, you pretty much have cancer. And they hand you the cancer bag, the horrible cancer bag, filled with all these pamphlets and all this information. And I thought, like, really? Like, is this actually happening? Like, it just didn't sink in. And I never thought that at 26, you know, you could be diagnosed with testicular cancer. It wasn't something that I'd heard of a lot, and I didn't really talk to a lot of people through work that had testicular cancer. So it was a huge shock. I mean, we had just started our lives, and it was happening so quickly. You know, that day they said, okay, you've had your surgery, you need to go to the sperm bank, like, the next day, we're gonna book you an appointment right away, and then you're gonna have chemo. And I was like, whoa, like, hold on a second. Like, we're not even thinking about having children. What do you mean we have to go to a sperm bank? What for? Like, and everything just happened so quickly, and it was so overwhelming. It was just something that I wasn't ready for. I know he wasn't ready for it. And to hear the C word from an actual personal perspective was different. You know, I again, like, I hear it every day when I talk to people, and I certainly feel for them in that way. But now I'm the caregiver. Now I have to support my partner that's going through cancer. What am I gonna do? So when he started chemotherapy, it was every day for 7-8 hours a day. And in the beginning, I wasn't going with him, and I'd be at work talking to other people that are currently going through cancer and their caregivers, and talking about chemotherapy and talking about treatments. And I thought to myself, here I am sitting, helping other people going through cancer, and my partner is right now getting chemotherapy 8 hours a day, and I'm not there with him, and I'm not there by his side. And it was the hardest time, and I think that first week that I wasn't with him. So I took a leave from work for 2.5 months so I could be with him going through his treatments, be there every day, make sure he's okay. And you know, that was the best thing I could have done. I know not everybody has that. Not everyone is able to take time off of work and be with their partner to take care of them, but for me personally, it was the best thing that I did. That way I was with him 24 hours a day, 7 days a week. And you know, it was tough. Definitely for a caregiver, watching him, you know, go through it all and take the treatments and be tired and not feel well and just not be himself and not be who we're used to being. And so that was definitely hard, and I felt helpless. I wanted to take it away from him. I wanted to take away the side effects. I wanted to take away the nausea. Every time he had to put the needle into him to go for chemotherapy, I hated that, and I hated watching it. I wanted to be the one that was enduring it, not him. So that was really hard for me, having to watch him go through it and really not being able to do anything about it other than care for him the best way that I possibly could. And I think that was really the hardest part. And for caregivers, I encourage you, reach out, have family and friends come in, give you that time, because I was so clingy and I never wanted to go out and I never wanted to be away from him just because I never, you know, something may happen. He might get a fever. The other family members might not know. They might not know the symptoms and the signs that something's going to happen. So I was always wanting to be right there. But really, it can burn you out. It can take a toll on you. And as a caregiver, you need to take care of yourself. And if you're not giving yourself that break and you're not taking care of yourself, then you're not going to be able to be the best you are for the person that you're caring for. So I highly recommend take some breaks, have some people come in and give you a few hours to yourself. Even if you're, you know, able just to go upstairs for a couple hours, take a long shower, a bath, read a book, a magazine, call a friend, whatever, as long as you're able to take that break for yourself. So that's what I would recommend. It was tough.
Your good days and bad days.
Absolutely, but you know, I tried to get him up, tried to get him walking. and getting exercise, drink lots of water, cook healthy meals, try the best you can. So it's certainly tough to be the person going through it, but on the other end, it's tough to be a caregiver as well. So.
And you know, of course, that one of the biggest challenges is one thing dealing with cancer. It seems a little different when you're a young adult, right? When you, like you said, Brittany, you guys had your whole lives ahead of you.
Yep.
And I mean, Luke, you said how you're now getting back. You got another album coming out. You're back playing the guitar and having good times. But you know, what about the times when you weren't sure when or if you were going to be playing that guitar again and making another album? Do you know what I mean? What if you're back now to a good spot? What about some of those low points? What come to mind for you?
Yeah, well, I guess it was pretty tough. You know, I was 27, and you know, finally I had a pretty good job where I could make ends meet and everything, and then suddenly, like, I couldn't work anymore, and I had to move back in with my parents, like back in Keswick. You know, if anyone knows where Keswick is, not a lot of 20-somethings want to be there, unless you want to buy a cheaper house. Yeah. So, nothing against my friends in Keswick, but it's your whole life changes, right? You think, I'm gonna move forward and I'm gonna do this, and then it's kind of like, nope, you're gonna go back and live with your parents and learn how to deal with anxiety and really just, you have to learn how to be okay with yourself again. So I think, you know, there are positive things that I can take from that experience. And I was lucky that I did have, you know, parents who took me back in and took care of me. Yeah, I'm back out on my own, and I live with my girlfriend, and we have a great apartment. I'm making ends meet again. I've got a cool job working for a guitar company. So really, I'm super lucky, and my goal now is to just deal with anxiety and start exercising more. I know walking to work helps, but I still, like, anxiety can creep up anytime. Like, for example, I had a swollen gland or lymph node around Christmas or around New Year's, and it just brought all these feelings of anxiety back, like, oh no, like, I probably have some other kind of cancer, or this cancer, or my testicular cancer came back, and I got all stressed, and I called my nurse team. The best thing you can do is just try to deal with it, like, tell someone, tell a doctor, tell a counselor, before you let the anxiety turn into a panic attack or debilitate you to the point of you can't even focus on anything else. So, yeah, even though things are fine, I'm still, like, it's gonna be part of my life, like, for the rest of my life, just knowing that I have to learn how to accept the present moment, and hopefully I'm getting better at it.
I think young males probably have a tough time learning to accept the physical condition that they deteriorate to. So maybe Dr. Nolan, you could talk a little bit about expectations that the guys should have when they do have to go through these difficult treatments. I mean, we've heard some stories earlier today about, you know, some guys want to go back and play hockey right away, but, you know, realistically, and maybe after Dr. Nolan says some, you guys can talk about physically where you're at after some of those treatments. What can people expect to a certain degree? I know each patient's different, but
yeah, I mean, there is a preventative thing you can do before you come out after your therapy, and you can exercise during treatment. A lot of different cancer sites, and with the different treatments, you can exercise. I worked with my brother. He's at his 1-year follow-up right now during his treatment for testicular cancer, and he was treated with BEP. And just realized that during your chemotherapy, as we did see earlier, it targets so many different systems, and you become deconditioned and you become unfit. But you can exercise during that phase, and it can maintain your conditioning. We can maintain it. We're not going to improve it, but we can maintain it, so at the end you're not as fatigued, you're not as weak, and then we can get you back into more of a healthier state afterwards. So if you get up and you move, and it's going to be hard. When I was working with my brother, week 1, week 2, it was okay, he could exercise, but that 5-day course, those 5 days, and it's just bam, 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 he was exhausted. But he said every afternoon he would go and he would lift. He had 4 kind of set different types of weights I would give him, and he would get up and he would do it, and he hated it. He was tired, he was fatigued, but he said for 2 hours afterwards he felt normal. He felt like he did not have cancer. Your body is beautiful. It can compensate. It does amazing things. Think of what you've just gone through, and you're here and you're sitting after all that poison injected into you. So there is a way of kind of getting through it if you can convince yourself you want to do it. But if you don't exercise, or you didn't have that opportunity or that knowledge, and I get a lot of emails from triathletes and cyclists kind of asking, well, I want to get back and I booked myself for the Ironman in Hawaii next year. I'm like, oh, well, let's talk a little realistically. So I try to explain chemo as it's like being in a car accident. When you're in a car accident, you see your physical damage and okay, I'm in crutches, I gotta walk slowly. But with chemo, it's inside you. You kind of see the hair starts growing back, but there's damage inside you. And so we have to make goals that are attainable so you don't quit, that you don't get too tired. And there's ways of doing that. So if you're on bleomycin and you may have breathing problems, you may have fibrosis, we can give you sort of intervals. And that way you work hard and then you get a break and you can catch that breath. And then you work hard and that stimulates change, and then you get a break and you can do it again. So that's a way of sort of, and you only have to do that for 10 minutes, 1 minute, a break, 30 seconds of exercise, like you repeat that. So there are ways of dealing with that side effect to get you back into your normal sort of physical self. And if you've lost muscle mass, lift weights, and what you do is you only allow yourself 1 to 2 minutes break between lifting weights. And if you do that, that'll increase the development, circulation of testosterone. If you wait 3 or 4 minutes, you don't get that as great a rise. So if I'm going to do a bicep curl, I lift a heavy weight 10 times, then I clock in, wait 60 seconds, lift it again. Okay, clock in, wait 60 seconds, lift it again. I'll have increased my testosterone levels, and I'll increase that muscle development. So that's sort of a technique you can do to get your strength back.
I just want to touch on something that you had said, which I thought was a really great point. You said that when someone's in a car accident, you can see physically that they're in pain and that they're not themselves because they've got crutches or whatnot. But after you go through chemotherapy or you go through treatments, it's internal and you don't see that. I remember when Steve's hair started growing back and he started getting color back and stuff like that, everybody started treating him differently, like he was normal again. And I know I did the same. Like, I'd be like, why aren't you vacuuming? Or why aren't you doing this? Or why aren't you in the garden doing that? Like, why are you slacking? And I have to admit that sometimes because he had his hair and it was growing back and he looked better and he wasn't laying on the couch like all the time anymore, I automatically sometimes assumed he's better. And sometimes I forgot that he had treatment and that he'd just gone through cancer and all these horrible chemicals, and I forgot about that. So I would say, like, let's go, and it's because I can't see it. He's starting to look normal again. So I think that's something definitely to keep in mind, that just because they look normal on the outside again doesn't mean that they're not feeling all these things like anxiety and all these types of side effects on the inside. And I do admit that was hard for me, and some days it still is when he has his long-term side effects. Still now I'm like, why aren't you doing this? Or what's going on? Or how come we can't go do this? But I forget that sometimes internally I can't see it, but there's things going on inside that still limit him. So I like that point that you said, and so wanted to add to that.
It's the only way to stop an Ironman.
Nick, what about being back at school? How are you feeling throughout the course? But take us through a normal day at school for you now that you're back after a pretty big layoff there. How do you feel throughout that?
I don't know. I wake up. I only have afternoon classes, so I get to sleep in every day, which is nice. And I'm taking a leadership and a foods class, so everything's easy. I really don't have to do anything. And yeah, I basically take the city bus there every day, and I get the school bus home. And yeah, basically, I have band practice like every day, so I don't really. I hang out with people, just like in, band practice.
Yeah. Would you say you have good and bad days? You say some days you feel like you're back, or some days you feel like it's really tough. It's tough all the time. How would you say, thinking back to it, how would you describe just getting through normal days of school now?
Everything's really easy. I don't know. I still get nauseous in the morning sometimes, but that's about it. It's not a big deal. It usually goes away after a couple of hours.
What about your diet? Has it? If you think back to years ago, has it changed significantly or whatnot?
Yeah, kind of like I don't know. In between every cycle of chemo, or during every cycle of chemo, I would lose a lot of weight. But I would always once I started feeling better after a couple weeks, I always gained it back really fast. And for some reason, after my last surgery, I haven't been eating as much. I just don't have as much of an appetite. So I am still probably at 150 pounds when I should be 170, 180. So, but my appetite's coming back, so it's pretty good.
Yeah. What about you, Luke? Anything changed for you on that front?
I kind of found that. Well, when I was going through chemo, the appetite was a main focus of my day-to-day. If it was late in a cycle and I got my appetite back, I would be making pizza and all this stuff and posting it on Facebook. I've got my appetite back. I don't know if anyone really understood how excited I was, but it's just it's just terrible not having an appetite, because I don't know, you'll take one bite of food and it does nothing for you. You don't enjoy it. You don't want to eat, but you have to eat. And then, that's one of the things I'm most thankful for now, is actually feeling hungry, even 2.5 years later. It's I'm so happy that I feel hungry. But when I do have little spells of anxiety, I've gone for, months at a time without having any anxiety, but like I mentioned, when the lymph nodes swelled up, which was nothing, by the way, my appetite again goes down, and I only eat half of my food or something. But also, I kind of feel when my appetite's back, I just want to eat whatever I want to eat, French fries every day and stuff like that. But I got to be more careful and just try to eat the right things when I have the appetite. It's hard to do, but I'm determined to be healthy, so try to eat healthy foods.
Andy, we had a couple of questions coming online, so I wanted to pose them and the chance for anybody in the audience to ask panelists to share their thoughts. One of them was a general symptom question. Margaret was asking if anyone had experienced ongoing head discomfort, feelings of grogginess, and unbalance. I'm wondering if that was something related to the anxiety people were feeling.
Yeah, I had that a little bit. I don't know. Basically, it just felt like it was like you were really high all the time, but it wasn't fun. It was just really scary. And yeah, it makes you not want to ever do drugs like morphine or painkillers and stuff like that, because I don't know. I don't know. if you take too much morphine, you start hearing stuff and start talking to people that aren't there, and it's not fun. And that mixed with the chemo is even worse, because you feel scared and you're hearing stuff, and it's almost like you're schizophrenic or something. It's really bad. But yeah,
I guess I can speak to that too. I did get the brain fog, as it's called, when you're when you're doing chemotherapy. So yeah, my advice would be to just sit down and rest. If your head feels dizzy, just really try to listen to your body as best you can. But again, try to get out for at least a walk every day. Like no matter what, get outside, get some fresh air. And but yeah, I would say I had a similar experience. I had a very foggy brain, and sometimes I still lose balance. I don't know if that's not seriously, like I don't fall over, but I still think I'm not really as sharp ever since doing the chemo. I don't know if it's just in my own mind, but sometimes I feel like I just can't think as quickly. But you never know if that's a side effect or just naturally getting dumber.
Steve, you got anything to add, or do you
yeah, chemo fog, had the same thing, lack of concentration. I think that's the thing there. It's hard to concentrate sometimes going through it. But it has been improving now. It's taken a while, but it has been improving. So, same thing.
Yep. Okay, Dana, you got it?
We'll go to the audience for any questions.
How did everybody feel as young men? Were you able to share the whole experience with friends and colleagues, or did you find that's difficult? Or there's some people you tell but not others because you think you're going to be the butt of all sorts of jokes? I mean, you made reference to Facebook and talking about having your appetite back. So, I mean, I guess in your case, friends were aware that you were on chemotherapy.
Oh yeah.
Maybe you could start it.
Yeah. Well, when I first was diagnosed and had the surgery, I would just tell people about what I was going through as I saw them or met up with them. But when I had to start doing chemotherapy, I decided that the best way to let everybody know what was going on was to do a blog. So I actually have a blog that's still out there called the Testicular Times, and I would just write about like all my feelings, like if I was crying that day. And I don't think I've ever been so open in my life with people, but it's probably not everybody's way of coping, but for me it was really helpful to just put everything out on the internet. Everybody could see what I was going through, so then I didn't have to worry about those awkward moments, like when they're like, how are you doing? Are you gonna die? And stuff like that. Or like, yeah, just rather than my whole family, like extended family, having to call and my parents or me having to tell people 100 times, we would just be like, go to the Testicular Times and read what I'm up to.
Yeah, I mean, I was really upfront with it. I mean,
three-part television series.
yeah, I've put it all. I've pretty much put my testicles on TV, actually, so pretty close. Yeah, I mean, I did the series and I was very open because, the further I got down the road, I realized, education was, education's out there, but until you get it, you go looking for the information. No one before they get it is looking for it. So education was important, and in what I do as a TV reporter, I mean, I believe in the power of personal stories in affecting change. And so once this happened to me, I thought, well, I'm in a good position to share this, and maybe someone will pay attention, maybe someone will check, maybe someone will learn something. I'm in that enviable position because I had a good outcome, and I was able to speak almost immediately from beginning to end. I didn't have to go through, I think I'm impressed with everyone here that you're willing to talk about the chemo experience, because that, I think I would feel angry and resentful of the world if I had to go through that at times, and to not go through that, I thought, okay, I can just be honest and just put it out there, and yeah, I mean, I think it's therapeutic. I mean, it was very therapeutic for me to share my story. The feedback I've got from people saying, you know, good for you for sharing, because I mean, it's an embarrassing thing that not many people, a certain amount of population, one, just doesn't want to talk about. Men, as men, don't really want to share their feelings, and so it was therapeutic for me. It has been therapeutic and important, and hopefully helpful.
Nick, what about as a Dr. Nolan? You want to chime in? I was gonna say, Nick, what about as a younger member up here, as a teenager? Aside from your parents, did you find maybe you had a friend, a counselor at school? Who could you lean on to talk about this? If anybody, how was it for you?
I don't know. Right when I got home from the hospital, when I had the ultrasound, and they told me about everything. I went over to my buddy's place down the street, and all my friends were hanging out there, just chilling in his garage. And I'm just like, guys, I have to tell you something. I think I have cancer. And they're just like, no way, you don't have cancer. And but yeah, they're just like, if you do, everything's gonna be fine. Like, we're rooting for you and stuff like that. But I don't know. I guess my friends were always there for me and stuff. And throughout the first few weeks, it was just them who knew. And over a while, like, word got around, and like everybody was supporting me. So I don't know. It wasn't so bad. Like, it wasn't really embarrassing or anything like that. Everybody was just like support. So it was good.
Dr. Nolan, were you gonna mention?
I just, something that I have heard a lot from patients as well as their family members is there's that sort of, almost it becomes stressful when you hear the C word and then you realize, oh gosh, now I have to tell my family and I have a crazy mom or I have a crazy dad. And now I, as the cancer patient, now I have to deal with my family members and I don't want to deal with that. And one thing that I've seen that works really well and is that when you're diagnosed and you just say, okay, I know I have support. I'm lucky enough to have supportive people in my life. I'm going to tell them what they need to do. So, you know, my brother, I just said, okay, you live really far from the hospital. You're going to ask 4 friends to drive you, especially during that week, that 5-day week. And then tell them, I don't want you to bring over food because I hate the smell of it. You know, I don't want you to crash my house or this friend, please come over and help me clean. And then your friend or your family member feels like I am contributing, but I now know I'm not smothering my guy friend, because that's something that's really important, because, you know, maybe the guy doesn't really want to talk about his feelings, but he may want your company for an hour, but no longer. So it's kind of a way to communicate, to say, what can I do, but I don't want to burden you, because you do have to remember that as a caregiver, you actually may be causing that person more stress if you're calling every hour and want to talk about it, and that patient may just want to sleep and not have to keep feeling like, I'm fine, I'm fine. So it's just something to have that communication and the patient be okay with saying, I don't need to see you today. Like, it's okay. I don't know if you guys feel that way.
Yeah. That's why I did the blog.
Yeah.
Testicle time?
Yeah.
Did you guys vlog as well?
I did the Facebook thing.
Yeah.
Instead of having family members constantly there texting, how is he? So I was like, that's it. That's enough. I'm creating a Facebook page. You want to know what's going on? And I would update it like, you know, he's doing well, or we're in this day, and da-da. So I kept it up to date, and he'd share how he's feeling that way.
Do we have any other questions from the audience? Or anything online, Dana?
Oh,
Oh, sorry.
Hey, I'm Nick's mom.
Nick's mom.
I just wanted to make a general observation and maybe just open it up to everybody out there who can perhaps comment on it. When Nick was first diagnosed, a lot of the parents at the school or other people I would tell about it would say, oh, well, no big deal, it's curable. So it's no big deal. And I know that some of the doctors and what have you have touched on some of these difficult side effects of the treatment. But honestly, it was a lot more harrowing when we were going through, when I was going through with Nick as a caregiver, and it was hell going through it as a caregiver. Some of the side effects were a lot more harrowing than what was conveyed. And Nicholas really underplays how absolutely horrific they were. Like, I just wanted to stress this because I think people often say, okay, testicular cancer, we can cure it, so it's not a problem. But honestly, the treatment is absolute hell. And he took the treatment to the nth degree. So he would have, like, the nausea was so extreme. So extreme. I remember the first week he underwent it, he lost 20 pounds in 1 week. He had the blood clot. He had osteonecrosis. So I remember for 2 weeks, he said he felt like a sledgehammer was hitting his knees over and over and over again. He'd be screaming. He'd be crying constantly because of the dexamethasone, the steroids, would so mess with his head that he would be freaking out. He would be having like these psychotic episodes. One time he was sitting at the dining room table and his eyes started rolling back in his head. He started convulsing and I had to rush him to the hospital. His chest pains were so severe it felt like he was having a heart attack. I'd have to take him to the hospital for the fevers several occasions. One time it was 104. He almost died from that. I mean, the only reason I bring this up is because I know you guys have talked about the side effects, but I don't know if they've been stressed enough. And the operation itself was like a near-death experience, essentially, the RPL and gate. And so we've gone through so many harrowing experiences as a family that it was so trivialized by the fact that people said, oh, well, it's curable, so it's okay. But, and I know Nick is a teenager, and as a guy, he's so easygoing and laid back. He doesn't really express himself as emotionally as I would as his mother, but I saw a lot more of the harrowing side effects. And I just wonder if you guys want to speak to that. Like, did people sort of bring that up? I thought that was kind of trivializing the whole cancer experience.
I want to touch on it first. And yeah, it is horrible having to go through the treatments. And I know that with working where I work, some people say, well, that's an easy cancer. Well, thank goodness you got that cancer because it's one of the best cancers to have. Well, no matter what type of cancer you have, it's not, cancer's not great. You don't want it, period. It doesn't really matter what type of cancer it is, you don't want to have it. And for the people listening in, what Nick went through was horrible, and that's certainly a lot for a young individual to have to go through, and same with the family as well. Keeping in mind that not everybody experiences those types of side effects from chemotherapy. As for Steve, he definitely had a lot of side effects, but nothing compared to what Nick went through. So chemotherapy is very different for everyone. Everyone's experiences are very individual. For Nick, it wasn't so great, whereas it may be not so tough for other people. So everything that you just expressed is pretty scary. If you're listening and you haven't gone through chemotherapy yet, it may not be that way for you. It's very different for everybody. And there are a lot of things to help, but yeah, that's tough to hear, and I can't really speak to that being the person that has cancer, but if you guys want to touch upon it.
I can speak to that. Yeah, I think by the sounds of it, Nick went through hell, and it shouldn't be trivialized at all. I think I did probably the least amount of chemo, and I would still consider it a very harrowing experience. But yeah, it depends how much and what type of chemo that you're doing and what physical state you're at going into it and everything. So everyone's going to react differently. But yeah, I did have some friends or people say like, oh yeah, that's the good cancer, or you'll be fine. That's something that did kind of get under my skin when people were just like, you'll be okay, I know it. And it's like, why say that to me? Like, you're just hoping for this to be over for your sake, but I still have to do it all. So maybe for some people it's good to hear, like, yeah, you're going to be fine, you'll be cured, but not for me. I'd rather you just say, is there anything I can do to help, or how are you feeling, or something like that.
Okay. Well, I just want to say a big thank you to everybody up here for being part of this today. I know it was helpful for some people in here as well as people at home. I have a feeling that Nick's not going to pursue a career in public speaking, but having him up here, it means a lot, and I think it was really courageous of you, Nick, and I think it's going to help some kids your age, because it happens to people in teenage years. So big thank you to everybody for being here, and turn things back over to Dan.